Yeah, that's anyway, it could have been worse. Yeah, doing the sound check on Facebook. Never have to do the sound check on Instagram because it always works really well. So yeah, this is a Q&A with yours truly, Jonathan Staiano. And if you've got any plastic surgery questions, Jackie's here. Oh God, sorry. Good to see you, Jackie. Then ask away. I will answer the questions that are preordained, but also on the sticker. So on the stick on Instagram, someone's asked a question, which is how many days are you an inpatient for after a BA, breast augmentation? So always very happy to get the questions on the stickers, you know, on the bits that we put beforehand. So everything really in terms of length of inpatient stay has moved down really a notch. So a breast augmentation used to be routinely an overnight stay, and it's routinely now a day case. So the specific answer to your question is day case. It's a day case for a breast augmentation, in and out the same day, even though it's a general anesthetic. You're fine to go home the same day. And in general terms, for instance, tummy tucks used to be 3 days, now they're 1 day. Breast reductions, smaller breast, well, this is all me. Everyone's different. I think, you know, this is just in my practice, but I think the general tendency for most people is to be going to shorter lengths of stay. So breast reductions, a smaller breast reduction would be a day case again. Bigger breast reductions would be an overnight stay, and usually things that need an overnight stay are ones that need drains. So I might use a drain for a bigger breast reduction and a tummy tuck. Capsulectomy, those are slightly bigger operations, so those might need drains, but still only 1 night in hospital. And a lot of other things, gynaecomastia, mastopexy, breast lifts, as I say, breast augmentation, breast lift with implants, all these things can be done as day cases, in and out the same day. And I think it's all moving that way. I think America did it a while ago. They were much more into their office procedures and day cases and less hospital stays, and we were not quite so, didn't embrace it quite so much, but now I think we are embracing it more, the shorter hospital stays. So thanks for that question. Next question, please. Can we remove a pilonidal pilonidal cyst? So a pilonidal cyst and a pilonidal sinus are kind of similar sort of things. So a pilonidal cyst is, I mean, I normally say we can remove cysts from any part of the body, but then people always ask certain parts of the body and always think, actually, no, not that one. And this is another one. It's not a question of can we remove it, it's that we wouldn't be probably the right people to remove it. So a pilonidal cyst or a pilonidal sinus is something that happens at the top of your natal cleft, so over your coccyx, over your tailbone, the cleft of your buttocks, just the top of the cleft of your buttocks. And it's usually caused by a little ingrowing hair, and it's often from hairs from your back that fall down into that cleft and work their way in to form a little cyst, a little lump. And it used to be called Jeep driver's bum because it was very common in the army and people who drove the Jeeps. It's nowadays, it'll be, I guess, truck drivers would get them. You can also, hairdressers sometimes get them in their hands, in their web spaces for the similar reason. Little hairs grow into the skin and form a little cyst, and they're actually quite difficult to treat, and they often get infected, particularly the ones on the buttocks in between the natal cleft. They can get infected, and they can require, usually the treatment involves opening them up, kind of laying them open, we would say, and packing them, and then changing that pack every day as the pack gets less and less. And that would normally be a general surgeon would be involved in that rather than a plastic surgeon. So as a general rule, we wouldn't get involved in removal of pilonidal cysts or pilonidal sinuses. That would be a general surgeon who would do that. Do we offer vein removal? No, I think that would be a vascular surgeon. So presumably that's kind of like little veins often on the legs, and they can be removed with laser or little micro injections, and a vascular surgeon do that. I think cosmetic doctors might be doing it, and there might be there might be plastic surgeons that do it. in myself and the other guys in the clinic, we don't do it. So at the Staiano clinic, we don't do vein removal, and I would probably point you in the direction of a vascular surgeon for that. What is the big deal about going to Turkey for surgery? I've been 4 times in the past 2 years, and everything's been fine. Yeah, this was an email I got from someone the other day, and I thought I'd talk about it on here, because there is quite a big deal at the moment in terms of going abroad for surgery, and for whatever reason, Turkey seems to be mentioned quite a lot. And I think the important thing to realise is that it doesn't mean that everyone is bad in Turkey and everyone is good in the UK, for instance. It doesn't mean you're going to be fine in the UK and you're doomed if you go to Turkey. So there are very good, very well respected, very well trained surgeons in Turkey. It's not like, this or anywhere abroad. There are, obvious. I mean, I say obvious. Is it obvious? There are very well trained surgeons everywhere in the world, and there are also badly trained surgeons everywhere in the world, unfortunately. But it's not like specifically a certain place has got bad surgeons. And what I have seen in my own practice, and what seems to be coming through with the BARPs are campaigning quite a lot about this at the moment, is the aftercare seems to be a problem. It's a combination of the aftercare problem, and there does seem to be some quite questionable surgery, some quite bad complications coming back, some bad results, some bad things happening to people that would not be in any way acceptable in this country. And if a surgeon was getting results and doing things that we're seeing, there would be significant repercussions. And I think the difficulty is having that accountability, having that feedback with the surgeon, with the clinic. And I think that's really the important thing if you are considering going abroad. I mean, I think we accept that people will go abroad for surgery. I don't think we're saying don't go abroad for surgery, because people will, because there's a significant difference in the price. But you've got to ask yourself, why is there a significant difference in the price? You've got to make sure that there are processes in place to look after you once you've had your surgery. If you have any questions, if you have any concerns, I can't tell you how many people reach out to me and asking for help when they've recently had surgery. And I always say to them, look, the price of surgery includes all the aftercare. That's the way it's structured. There's one price which includes the surgery and all of the aftercare. It is not one price for the surgery and one price for the aftercare. So that might be why it was a lot cheaper, because maybe they didn't have a great aftercare. And it's not very helpful to say that to people who are struggling now, but you can say that to people who are in the research phase. Say, look, have a look at the aftercare, have a look what sort of processes are in place. I hear all the time that it was a WhatsApp number and they've blocked me on the WhatsApp because I'm complaining, and then that's it. They've got no way of contacting them, which is fairly shocking. Have I got some kind of hue on me? Which is fairly shocking and would not be tolerated in this country. And so that's just something to be aware of. I'm not saying everybody does it. I'm not saying that there are clearly a lot of people who go abroad, who've been abroad, who've had great results and are very happy with everything. It just seems to be a disproportionate amount of people who are having problems, having concerns, not getting their concerns listened to, and not being looked after. And the problem is they're really struggling to get help in this country. And in fact, the person who wrote this email said, my GP is very supportive. And I'm like, really, you shouldn't really be involving your GP significantly. We always write to your GP, let GP know you're having a procedure done, but any follow-up, any aftercare is done by us, and to say go to your GP if you've got any problems is not really fair on the GP. There's a lot of pressure being put on the NHS by having to do remedial surgery, and then they will only deal with the complications. They will remove the implant if it's infected. They will deal with the acute infection, but they won't deal with the sequelae after that, the cosmetic implications or the scarring or the other things that might be of issue to you. And one, that's kind of in a way putting a burden on the NHS. And two, it may not be ideal for you because you might want to have the cosmetic side of things addressed, because presumably you've had cosmetic surgery for a cosmetic reason, and if it doesn't look right, then you're understandably going to be unhappy. But it's, as I say, it's very hard to just take someone on to just do the aftercare. the price you pay includes the whole package. So when you've paid that to a surgeon, whether it be in the UK, in Turkey, or Prague, or Brazil, or it doesn't, you know, anywhere in the world, whenever you paid for your surgery, that surgeon, that clinic then has a responsibility to look after you and to make sure it's all heals well and you're happy with your results. That is part of the price you've paid. So if you're not happy and then at 1 week or 3 weeks you go to another surgeon and say, look, can you help me? You may struggle to find the surgeon to help you because we are, you know, we're not set up to just have an aftercare package. And so that and it is difficult when talking to people like that, because you kind of feel unhelpful, but at the same time it's like that is what you've got to be doing in your research page. You're looking for someone who's going to look after you, looking for someone who's going to listen to you and look after you. And I'm not saying everybody abroad doesn't do that and everybody in this country does do that. I'm not saying that at all. I'm just saying if you're going to have surgery, those are the sorts of things you need to be looking out for. What sort of comeback have you got if you have questions, if you have concerns, if you have a little niggle? Because let's face it, it's, you know, there's a lot of niggles, concerns, maybe not massive complications, but if it's a concern, swelling, lump, bump, asymmetry, can take ages for these things to settle, and you need to be nurtured and looked after that period. So and it does seem to be a problem at the moment. So we're all trying to raise awareness of this to empower the patients. Everyone says, oh, there should be legislation, etc. Yes, okay, there should be legislation, but that's going to be sometime in the running, and whether or not it ever comes about. And in the meantime, I think the onus is on us as reputable plastic surgeons to talk to people, to let them know what sort of service we offer and what sort of aftercare we offer, so then they can compare it with other places and make an informed decision as to where to go for, rather than just saying that place is £10,000, that place is £2,000. Well, I'll go with the £2,000 one. So rather than just saying we're £10,000, we've got to say we're £10,000, and that includes all of the aftercare. This is how we do it. This is when you see the nurse. This is the sort of communications we have. This is the sort of aftercare policy. This is what we'll do if you're unhappy with the result. And this is what's covered, you know, and you know, these are the sorts of conversations we need to have with people, so that then when they go to the other place, they can say, what is the, you know, how am I followed up? What's the aftercare? You know, will I be speaking and seeing the surgeon again? These sorts of things. And the problem is, well, not the problem is, I mean, the fact is, a lot of cosmetic surgery is, it's got a low complication rate. So there is always going to be a lot of people who are absolutely fine. But the problem comes when if there is a complication or there is an issue. They can be significant. They can be really significant. I mean, it is not minor surgery. Just because it's cosmetic surgery does not make it minor surgery. It is still significant surgery, and there are potential for significant complications that might need intervention, might need help. And it's, you know, there's an awful lot of people who are lost, who are not getting the support they need, and having to rely on surgeons in the NHS and having to rely on GP and things like that, who are not equipped for this sort of stuff, and who are probably, you know, only helping in the sort of basic way, rather than really trying to embrace and focus on the whole issue. So just be aware of asking questions about your aftercare, about contact with the surgeons, and you know, how you're going to be dealt with wherever you're having the surgery, whether that be the UK or whether that be abroad. That's the message, really. And it's not trying to say everything abroad is bad. Just be aware and ask the questions. Be informed so you can make an informed decision as to where you have it done. Do we offer surgical lip lift procedure? No. Don't really do facial aesthetics. So no, don't really do that. No. So yeah, I've seen you know, a while ago, my friend Mark Pacifico, Purity Bridge. I've seen some photos of him. Well, I don't know if it's him, but someone in this clinic doing it and things like that. But yeah, seems to be a thing, doesn't it? Take a bit of skin out from the top lip. Can't really show because I've got a beard. Lift the lip, sort of like that. Lift procedure. Does that look better there? Not sure if that does look better, to be honest. Not sure if I'm advertising the lip lift procedure, but I don't do it, so don't listen to me. But no, we don't do it. Sorry. Can you recommend any alternative forms of treatment instead of gynecomastia surgery? Well, I can tell you about alternative forms of treatment, but whether I can recommend them or not. So the mainstay of treatment for gynecomastia is surgery. The other treatments are things like hormonal treatments like tamoxifen, which are said to shrink down the gland. There are some causes of gynecomastia. It's usually due to hormone imbalance, and there are certain times of life like puberty and senility. So, during puberty and when you're older, that the hormone imbalance is such that the estrogen to testosterone is more in favor of the estrogen, and so there is an increase in the breast tissue growth. So gynecomastia can be an issue. So certainly with the puberty group, you need to wait until puberty is finished because that might improve it. So I guess that's a form of treatment just by waiting. And again, tamoxifen, it is a way of treating it. I don't know of, I don't do that. I don't prescribe that. I think some breast surgeons might prescribe it. I'm not sure if GPs will prescribe it, but I'm not sure about hormone treatments, how effective they are. But that is definitely an alternative form of treatment that you could consider. And I saw someone yesterday or the day before who'd had hormonal treatment. But as I say, the main cause of gynecomastia is what's called idiopathic, which means we don't know what the cause is. There can be hormone-producing tumors and certain drugs that can cause it. So removing the cause, if there is one, but the vast majority have no cause. And the mainstay treatment is surgery. So I'm not sure of any really good alternative forms of treatment. But as I say, I don't really do them, and I've never really seen anyone who's had a good effect from them. But that might be because I'm seeing a self-selected group of people, and there might be lots of people out there who've had hormone treatments who have benefited from it. So really, I guess talk to someone who does it. But in my practice, the mainstay of treatment of gynecomastia is surgery. How long after having Mummy Makeover (brackets tummy tuck and breast lift) can I return to weightlifting? Look at that, weightlifting, flipping heck. Okay. Well, I'm guessing that the main one out of those two is going to be your tummy tuck. When you're having a tummy tuck and a breast lift, or kind of like a breast procedure, usually the tummy tuck is the overriding one in terms of the recovery. So first 2 weeks, don't do anything. Well, you can walk around, move, because you don't want to get a DVT and things, but moving and walking around, but nothing in terms of lifting or what have you. After 2 weeks, lower body stuff. I normally say in terms of upper body, like putting power through the upper body, a month is my normal recommendation, a month for putting power through the upper body. So I guess weightlifting would qualify as putting power through the upper body, but it sounds quite hardcore when you say it like that. When can I return to weightlifting? So I'd probably revise my month thing to say kind of like probably 6 weeks, and then just gently get into it. You're going to be engaging your core with weightlifting, so I'm going to say little weights. Don't want to be what's the word? I don't want to make out as if you're not able to carry big weights, but I would say start with those little dumbbells, little hand ones. Maybe after 4 to 6 weeks, but I wouldn't do anything with the big bar and engaging your core probably for a couple of months, and then I would just do a small one and then see how you feel, because we have to bring the muscles together often, not always, but often. Usually I would say we bring the rectus muscles together with stitches, so you don't really want to be putting an awful lot of tension on that, which I would imagine when you're doing weightlifting, you're going to put a lot of tension on that. So you want to give it a good couple of months before you start to do it. And that's the important word, start. Double underlined and highlighted the word start. So start to do it after a couple of months and see how you feel. If it hurts, if you feel it pull, oh my God, if it swells, back off, and then maybe leave it another few weeks. If you try and do stuff too soon, particularly if you're doing too much too soon, big heavy weights and stuff, then you run the risk of it. Well, worst case is swelling. I suppose best case is nothing, but if something bad's going to happen, swelling is kind of the main thing. But I guess worst case, you could put tension on those stitches. You could potentially pull the stitches because you pain, could cause bleeding, obviously putting tension on the wound as well, because the wound's under a lot of tension when you do a tummy tuck, and you'll find that you're kind of bent over double for a good couple of weeks afterwards. So yes, I would say good couple of months before you start doing upper body exercises. Then start gentle with just little dumbbells, I would say, and just see how you go. And probably a couple of months before you start with the bar. And even then, maybe just start, because I've seen this, you can do the bar on its own, can't you? Because the bar itself has got weight. So just start with the bar on its own before you put any weights on. See how you feel. There's often a bit of a delayed reaction, so see how you feel. Give it do a little bit with the bar on its own, and see how you feel that evening. Because sometimes you can think, oh, that feels all right. I'm going to put some weights on, do a bit of this. Oh, I'm feeling good. You get home and you think, oh my God, what have I done? It's all swollen. So there's often a bit of a delayed reaction. So just be aware of that. Be mindful of that. Was that a bit of a gabble? Anyway, I'm out of my questions. I'm all out of questions now. So that is that in terms of the questions that I've got. If you've got any questions, you can ask them, get them in, and I will answer them. But if you don't want to just get them in on a one-to-one basis, just call me, email me, Instagram me, Facebook me, YouTube me. Just get in touch, and I will do my level best to answer them next week. And we will stick them on the list, and I will tackle them head on. Only way to do it. So if that's it, I will bid you good night, and I will suggest you go and put your feet up. I'm tired. I tell you, it's a big week this week, all the proms and everything this week, starting as of tomorrow, proms and graduations and stuff for the children. So if that's you as well, then good luck with that. Might see you there. Oh look, here we go. Kimberly Owen, I'm pleased with my breast augmentation. Look at that. That's the sort of recommendation we want. That's jolly good of you to say so, Kimberly. And I think I'll see you soon. I have reason to believe. Very kind. I'm pleased. I'm very pleased that you're pleased, and I know. It's good. Excellent, Kimberly, and I look forward to seeing you soon. It's been a while since I've seen you. So I will, on that positive note, thank you, Kimberly. I'll go and do a bit of, sitting on the sofa. Good night, JJ. Thanks for the chat. Always informative. Good night, Corinne. Well, not good night yet. It's only 7:30. Not that bad. Give it a couple of hours. Would def recommend you Friday. I'm coming for an appointment. Awesome. Thanks, Jackie. Have a good evening yourself. Looking forward to seeing you on Friday, Kimberly. And have a good evening. And I've got to do a bit of a slicker way of signing off for these things. Anyway, looking forward to seeing you on Friday, Kimberly. So I'll see you then.